Osteoarthritis is a debilitating chronic disease affecting 1 in 11 Australians, approximating to 2.2 million people in 2017 to 2018. It is a chronic inflammation of the joints where the most common occurrences are the knees, hips, fingers, and big toe. The prevalence increases significantly for those aged 45 and older. Osteoarthritis causes pain in an individual's joints, which greatly interferes with everyday tasks. Currently, patients take pain medications and undergo exercises whilst being supervised by a physiotherapist. As of today, there exists no device that monitors osteoarthritis in the hip, and our device aims to fill this niche.
As the disease progresses, pain can manifest in the joints at simple movements and may even persist in the absence of movement. Patients are then unable to perform normal daily tasks, they may require additional support and supervision, and this itself already poses problems. Patients can't participate in social events or travel often. If they do, they need to be supervised. Some patients can't get to work, so there's no source of income, and that will lead to a financial crisis on its own. And eventually, mental disorders start to settle in osteoarthritis patients. If we let the disease progress, or if it's neglected, comorbidities become prevalent. Obesity and diabetes are risk factors for the onset of osteoarthritis, but can also worsen since patients are unable to engage even in minimal physical activity. So a combination of both these diseases can further complicate into cardiovascular diseases and renal dysfunction. So in essence, osteoarthritis will eventually lead to a decreased quality of life and increased mortality. However, before complications of osteoarthritis set in, they are preventable and manageable with exercise and rehabilitation programs. The problem for us clinicians is that we manage and treat numerous patients that it's hard to keep track of how the patients are progressing through the disease. So are they getting better? Are they getting worse? Is the exercise program set working for the individual patient? So by developing a wearable device, us clinicians can gain further insight into the progression of the disease and allow us to conduct a thorough observation of patient performance and the exercise programs. And this enables us to completely personalize a healthcare plan tailored to the patient's situation.
Expel is an adjustable Velcro belt worn around the hips and is powered by a rechargeable battery. It is used at home and monitors rehabilitation hip strengthening exercises prescribed by physiotherapists. This removes the need for patients to perform exercises at physiotherapist centers, resulting in increased comfort and efficiency. Expel has 4 main components: accelerometers, a gyroscope, ultrasound patches, and a temperature sensor. Hip movements are measured by accelerometer, which detects acceleration forces, as well as a gyroscope, which detects angular velocity. Ultrasound patches visualizes the joint such that abnormalities can be identified. Likewise, the temperature sensor measures skin temperature of the patient, as this is correlated with osteoarthritis severity. Improper hip movements and the worsening of osteoarthritis can thus be effectively identified.
Signals from the sensors are sent to the device CPU, processed and simplified to the patient through an app on their phone. The app will show the range of motion, areas of severity, as well as feedback on exercise form. The patient will also report their pain on a scale of 1 to 10. The app additionally features the patient's profile, treating clinicians' profiles, history of data from previous exercise sessions, and reminders for their future ones. Clinicians have private access to the patient's information, and they can see whether they're adhering to the treatment program. They can also use this information to determine whether the treatment is working or needs any adjustments. Patients and clinicians can communicate through the app through messages for simple inquiries. Clinicians will contact patients directly when adjusting the treatment or matters of concern.
So monitoring osteoarthritis progression has always been an unclear path for both clinicians and patients. With the assistance of Expel, physiotherapists, doctors, and patients with any stage of osteoarthritis will be able to effectively monitor progression of the disease. Our osteoarthritis population is increasing, and by 2032 it will be more than 3 million people, and the rise in the aging population presents presents many challenges in osteoarthritis healthcare management. We believe that XBELT will be a pioneer in the osteoarthritis market, and the monitoring progression provides an effective two-way communication between patients and clinicians in the future. General physicians will be able to monitor current and upcoming progression of different individuals, which is essential in providing proper advice and treatments. XBELT strives to shift current monitoring management into self-care strategies for patients, allowing them to perform exercises at their convenience. Therefore, XBELT really is a device that can aid in decreasing healthcare burdens in our society and improve future healthcare.